These briefings are part of Brown County Public Health's collaboration with our local healthcare systems. We have Advocate Aurora Health and Aurora Bay Care Medical Center, Bellin Health System, Prevea Health, HSHS St. Vincent and St. Mary's Hospitals, Oneida Nation Public Health, and De Pere Public Health. I do want to let everyone know that this briefing is being recorded in speaker mode, so when you receive the recording later today, you should be able to use it for your story visuals. We have a lot of information to share with you today. Following my update on current numbers and a few other items, we're going to focus on the vaccine, since we know that's what's on everyone's minds these days. Today joining us, we have Bellin Health Infectious Disease Specialist, Dr. Michael Landrum. He will talk about the current status of the vaccine rollout in our area. We know there's a lot of misinformation out there about the vaccines, so Oneida Comprehensive Health Division physician, Dr. Ravi Veer, will talk with me about vaccine myths and facts. All of us, the health departments, as well as our healthcare system partners, have been receiving a lot of questions about pregnancy and the vaccine. Joining us to talk about that will be a Prevea Health OBGYN, Dr. Jessica Lashinsky. And we will also discuss children and the vaccine with Dr. Donald Bino, a local pediatrician of 16 years at Aurora Bay Care Medical Center. Finally, we'll wrap up with a general discussion about why people should be vaccinated. Of course, we will end the briefing with media questions. First, we want to bring you up to date with the current status of COVID-19 in Brown County. Right now, we are at 26,831 confirmed cases. That's an increase of 172. We have 72 individuals who are hospitalized. Out of isolation, we have 24,398. We're standing at 136 deaths, but thankfully 206 people have recovered since that out of isolation number, which was 24,398. As always, you can find an updated dashboard daily online at www.stayhealthybc.com. You can also check out the Wisconsin Department of Health Services website for current information. Before we go to our guest speakers today, I'd like to briefly talk about two other items. We are being asked if the variant strain of the virus has shown up in Northeast Wisconsin yet, and if we're testing for it. We have not seen the variant strain in the state of Wisconsin yet. If and when this happens, communication will come directly from Wisconsin Department of Health Services. We've also received some questions about the new Dhs Tracking App, where you can opt in and receive notifications if you've been exposed to someone who has COVID-19. This app was a system that was developed by DHS, so the best thing you can do if you have questions about it is go to the DHS website, which has a comprehensive overview about what the app is and how it works and how to download it on your phone. With that, we'll turn our focus to the vaccine. So I want to thank you all, Dr. Landrum, Dr. Veer, Dr. Lashinsky, and Dr. Bino for joining us today. I understand that all of you have been vaccinated. We'd just like you to share with us what that process was like, what actually getting the vaccine was like, and if you had any reaction to the vaccine. So Dr. Bino, can we start with you?
Sure.
What was your experience?
It was mild soreness with the first dose, absolutely no reaction at all for the second. The soreness lasted a day and back to totally normal. Thankfully, no side effects at all. The process was straightforward and easy. Our vaccine clinic was very quick, in and out. The monitoring, we've chosen to take a 30-minute monitor to ensure there isn't a reaction. So far, everything has gone very, very well.
Excellent. Dr. Lashinsky, what about you? What was the process like for you?
The process was also pretty straightforward. I got my vaccine in Sheboygan at St. Nick's Hospital. I had previously had the infection and was told that I was going to have lots of bad side effects and all of that, but I got the vaccine at night and went to sleep for a little while and didn't really notice a difference in the way I felt, other than a sore arm, same as the flu shot. So yeah, nothing to report here.
Dr. Veer, what was the process like for you?
Pretty painless, like my colleagues here described. I was on schedule for the vaccine on a Tuesday. I received the vaccine in my left arm and had a sore arm like you do with a typical flu shot, and that was about it.
And Dr. Landrum, any thoughts on your process?
So our process was very similar. We checked in, or I checked in. They went through a series of just kind of screening questions about allergies and those types of things. And it was just like getting any other vaccine after that. And then I, stayed around for a few minutes, of course, for monitoring like is recommended. My side effects were also pretty mild. I did have a little bit of a sore shoulder after the first dose for about a day. And that was it. I was able to still exercise and do everything else, work, whatnot. And then after the second dose, which I received on a Friday evening, the following day, Saturday, my shoulder was a little bit sore, but then pretty mild. I did have a little bit of fatigue for, I think, maybe about 8 to 10 hours, but that resolved and I felt fine. I did, as reported in some of or in the studies, I did develop a few swollen lymph nodes under my arm from the vaccine, but not really painful or tender. Didn't really cause any problems for me at all. So just part of the reaction, showing that my immune system was doing what it was supposed to do.
Thank you all for sharing about your experiences. As most people know, frontline workers have been receiving vaccinations for several weeks now, and the rollout is continuing. So we actually just got an update. I'm going to pause before I go to you, Dr. Landrum. The variant strain was found this morning at around 10:15 a.m. Communication came directly from DHS. So just like I said it would. We don't know much about it. We don't have very many details, but you can feel free to reach out to the DHS media team, and I'm sure they'd be able to answer any questions about what they found about that variant strain. So Dr. Landrum, let's talk about the vaccine rollout. Can you tell me who has been vaccinated so far, just maybe like some general categories of those being vaccinated at this time?
Right. The two broad general categories of for individuals getting the vaccine so far have been healthcare workers, and then residents and staff at long-term care facilities such as nursing homes. So that's where the focus has been really for the last few weeks since we started receiving the dose here in Wisconsin. I believe the total number of vaccines administered statewide is about 160,000, and seems to be increasing day by day, week by week. So the pace of immunization is picking up.
You sort of answered this a little bit, but who is next in line to be vaccinated, and how does that get decided?
That's a great question. So first, I'll answer the second question, which is how does that get decided? Who is really making these decisions? And so the CDC, of course, has their recommendations for prioritization for the vaccine, and then those get adopted here at the state level by a committee called I had to write it down, make sure I didn't mess this up, the State Disaster Medical Advisory Committee, or the SDMAC. And they have a subcommittee on the vaccine that's formed. And that includes 17 members, health leaders, physicians, pharmacists, community members from across the state that really sit down and wrestle with how are we going to prioritize the vaccine or apply the CDC recommendations to our state, because Wisconsin has demographically a slightly older population than other states. And so there are some differences and reasons why we would want to look at our state and try to come up with more local recommendations than those from the CDC. They actually just had a meeting, I believe, yesterday, and posted online their preliminary recommendations for who is next, or phase 1B. They've been debating this for a couple of weeks now, so it's posted online. And I'll go over those groups here in a minute, but people should know that you can get access to that if you disagree or you have feedback. They're taking public comment on the prioritization. So, people from the community and anyone can really get online and give feedback to the committee on their prioritization. They go through in their document who is next and why. They also have a good discussion of why these groups are being picked. And it is not a perfect process. There are going to be exceptions, exclusions, things like that, that, don't seem to make sense when you're doing something this broad. So it's not perfect. They recognize that, but that's the process. So the groups largely are those who are 70 years old and above. So those, because they're at such high risk for COVID and for hospitalization. So that's why they are next in line for the vaccine. In addition to that, people who are enrolled in the state's IRIS program. So that is a group of individuals who receive, they include frail elderly individuals at home, as well as other Medicaid recipients that are receiving disability and home care. So they're an at-risk population here in Wisconsin specifically. In addition, first responders, non-EMS first responders, the EMS first responders have already been getting vaccinated as patient-facing healthcare workers, but other first responders will be eligible for vaccination. First-line educators, so daycare workers, teachers, those folks involved in education, and then people who live in congregate settings, so people in shelters, people who are in a congregate setting like their employer, they're in a work-related housing situation, those individuals, prison staff and inmates as well in congregate settings. Those are the primary groups. There is one kind of group that's a very small group, but interesting, I think, and that is mink husbandry. And some people may scratch their head and go, what on earth, why are they included? And so the reason for that is actually because mink are also susceptible to SARS-CoV-2, the virus that causes COVID-19. And if it passes through, if it goes from a human to a mink and then back to a human, there is increased chance by passing it through an animal that there will be additional mutations to the virus that could then cause a significant alteration in the virus itself that could impact vaccine effectiveness, disease severity, all those things. So that's why we want to try to include them up front in getting them vaccinated. There was an outbreak in, I think, someplace in Scandinavia associated with mink husbandry, and they saw some of that. So that's why they're included, if you're wondering. But long answer, but those are the groups, and they're available online.
I actually heard about the mink husbandry thing yesterday, and there are a couple very large mink husbandry places in Wisconsin. So
yeah,
something new every day. What kind of vaccine security is happening, Dr. Lander? What's involved with that? What steps are being taken by healthcare systems?
Right. So I can speak specifically here for Bellin. We have our storage of the vaccine. It's in a non-disclosed location. Only a few people really here know where it is. So it's locked, it's protected, it's under 24-hour surveillance. Security is very aware of it. And only a very, very few people, number of people have access to the actual storage location. So we are very serious about keeping it secure. I know other facilities have also not publicized their locations for where the vaccine is being stored because we really don't want to have any security issues.
A lot of people in the general public are wondering about when it will be their turn. Should they be contacting their providers, or what should they do if someone's interested in receiving the vaccine?
Yeah, that's a great question. I think at this point, I would refrain from contacting your local doctor's office because they're not going to be able to answer your questions as to where and when can I get the vaccine. That's just not quite there. Probably within the next 1 to 2 weeks, we will have that information available, but it would lead to flooding your doctor's office with phone calls that they wouldn't be able to answer. Rest assured that there will be a large media campaign and through public health and messaging online, on social media, through television, the paper, all those outlets will all be notified, and it will be, I think, hard to miss when you're up for your immunization. And then Bellin, I know, will be also directly messaging patients either electronically, primarily, to let them know that it's their time to get the vaccine.
Great. Anything else, Dr. Landrum, that you feel like we should know about vaccine distribution?
I guess I would just comment on the frustration that has been shared by others that it's not going fast enough. And I would just like to say that we in the healthcare systems acknowledge that. It's frustrating for us too that we're not able to get it going faster. This is a huge undertaking for our country, really, let alone the state. But the mass production, the mass distribution, and the mass administration are all things where we are inventing processes to get this done as quickly as possible. We are working very hard to accelerate that process. The process is going faster, and so I do think things will pick up. The vaccine supply will pick up. So just to reassure folks that things will get moving faster here, but we do acknowledge that it's been frustrating so far.
Thank you so much, Dr. Lander. We appreciate your insights. As all of you know, there's a lot of misinformation out there about the vaccine, so we want to tackle a few of those items today. Dr. Ravi Veer from the United Comprehensive Health Division is joining us for this topic. Welcome, Dr. Veer. Can you tell me if this is a live vaccine, and if it's not a live vaccine, what is it?
No, this is not a live vaccine. This is actually a messenger RNA or mRNA vaccine, which is an entirely new type of a vaccine. Short answer, no, this is not a live vaccine. It cannot give you, you cannot get COVID from this vaccine.
And you just answered my next question. So you cannot get COVID from the vaccine. Will it change your DNA?
None of the vaccines that are authorized or any of those vaccines that are currently in development by the different agencies are live vaccines. So you cannot get COVID disease from any of these vaccines. And to answer your second question in terms of would this change our DNA, the answer is no. The COVID mRNA vaccines do not interact with the DNAs. They do not enter the nucleus of the cell. This is an entirely new process of vaccination distribution, but this mechanism actually has been in production and research for more than 2 decades. So what this does, most traditional vaccines, what they would do is put in a weakened version of the germ into our bodies, and our body mounts an immune response to that germ to create immunity. What this vaccine does, the messenger RNA vaccines, both the Pfizer vaccine and the Moderna vaccine follow the same mechanism, so to speak, and they actually instruct our cell to create a portion of the protein. In this case, that protein is the spike protein. That's similar to the protein that's on top of the coronavirus itself. So that protein induces this immune response in our cells, and the messenger RNA, once it's in the cell, actually is destroyed by the cell. It does not enter the nucleus of the cell, and usually it's within the nucleus where the genetic material resides. So it does not change our DNA in any way.
Is there any tracking mechanism in the vaccine?
That's an interesting question, and the answer is absolutely not. There is no tracking mechanism in the vaccine. I think this really points to a lot of misinformation out there. There's the internet and social media are actually a wonderful resource for information. They're also an unprecedented source for misinformation. If you look at the idea about this vaccine having some kind of a tracking mechanism, that's absolutely untrue. What I do recommend patients and our community members to do is to reach out to some reliable sources of information. And the ones that I recommend highly are CDC, the National Institutes of Health, and the Wisconsin Department of Health Services website that has some really good resources for vaccine information.
Does the vaccine prevent you from getting COVID?
Yes, these vaccines are actually very effective. The efficacy rates have been 94 to 95% in preventing the disease. What they are also potentially doing is preventing us from getting seriously ill if we do contract the illness even after vaccination. There's ongoing studies about the vaccination and how this would potentially affect the infectiousness of an individual that gets COVID. So those studies are ongoing, but they're very effective vaccines in preventing COVID-19 illness.
Does the vaccine prevent a person from spreading COVID?
We do not really have a clear answer to that question at this time. There is a community aspect to this, which what we call the collective immunity of, or herd immunity. So once we get to a point where an adequate number of individuals in the community are vaccinated, then we would definitely get to a point where we're all collectively protected against infection. We do have studies ongoing now to see how much of the vaccine, how much of that protection is against infectiousness. So short answer, we don't know yet, but at a collective level, definitely once we get to a point where we reach herd immunity, we will all be protected.
Are there any other misconceptions or rumors that you've heard that you'd like to address?
One common one that I heard, and this was a question that came from one of our community members, was this vaccine, could this make me infertile? And the short answer to that is absolutely not. Again, this is not a new rumor. There was a rumor about polio vaccine, which has been around for decades now, causing similar type of infertility concerns, which is not true either. So I really firmly believe that these are safe vaccines, and and very effective. To put that in perspective, 95% efficacy is impressive. In a good year, we get 50 to 60% efficacy with the flu vaccines, for example, to put that in perspective. I do want to emphasize a couple of things to the community in terms of vaccination. We've got multiple tools in our toolbox now to prevent the spread of the virus. So we got to keep those tools, and now this is an additional tool in our toolbox to prevent the disease. However, one question that keeps coming up is, well, now that I got my shot yesterday or last week, I don't have to really use those precautions of masking or safe distancing, washing hands, and that's really not true. We will eventually get to a point where those safety measures may not be needed, but that is not the case currently. So please do keep safe distance, hand washing, masking, and if you do get symptoms related to COVID, or if you're sick, don't report to work, stay home, and do get tested. So testing and contact tracing are still really critical in our efforts to reduce the spread of this infection.
Thank you so much, Dr. Veer. We really appreciate your insights. We're going to continue to talk about some of the myths and the facts that are out there. Now we're going to move our focus specifically to pregnancy and fertility. Dr. Jessica Lashinsky is a board-certified OBGYN at Prevea Health. Welcome, Dr. Lashinsky. Can you tell us what the current recommendations are for getting the vaccine if you're pregnant?
Hi, yes, I'd love to. So the American College of Obstetrics and Gynecology, ACOG, recommends that the COVID-19 vaccines should not be withheld from pregnant women. So, the vaccine should especially be considered in pregnant women with other high-risk medical conditions. Pulmonary conditions, autoimmune disorders, diabetes, right? Even not having the perfect BMI. So obesity, many more conditions sort of send you into that it shouldn't be withheld to it should almost be recommended category. Getting the actual COVID-19 infection while pregnant, the actual infection has been linked to more serious maternal illnesses requiring ICU admissions, long-term pulmonary or cardiac effects, and also some adverse fetal outcomes like preterm delivery or stillbirth. So if we can avoid that with the vaccine, ACOG and our other governing bodies that talk about pregnant women definitely suggest it. Some other things as far as what's the recommendation while I'm pregnant. questions that I answer daily. There's no specific trimester that needs to be avoided when getting the vaccine. You know, if you find out you're pregnant before your second dose, you should still get it just as you scheduled. There have been many pregnant women that have found out they were pregnant after getting the vaccine, and there have been no increased rates of miscarriage or adverse effects with those women. You know, there's no preference for one vaccine over the other, Moderna versus Pfizer at this time. The only thing that they say is that the vaccine shouldn't be given within 14 days of other vaccines that we recommend in pregnancy. So the tetanus, diphtheria, pertussis, that Tdap shot, or your flu shot, you know, we space those out 14 days, you know, before or after you get vaccinated for COVID-19. You know, there's really not a lot of data that we have, and I think that scares people. Because pregnant women haven't been tested or included in these studies early on, the studies are being planned and implemented, you know, very, very near future. There's no safety data specific to pregnant women with many medications and many vaccines at the beginning. But there's a general consensus that it's safe. There's no data or scientific evidence that says it's unsafe. There have been many reports, saying that the women that received the placebo arm of one of the Moderna studies actually had higher miscarriage rates than the women that received the vaccine. So, you know, if patients are interested in a more definitive recommendation, because no governing body is going to say, yes, do it now, I encourage them to talk to their OB provider about their specific risks in their medical history, work environment, risk of exposure, so they can weigh those specific risks and benefits.
Could getting the COVID-19 vaccine pose any risk to plans of a future pregnancy?
No, I agree with Dr. Veer. This probably has been asked the most. The vaccine is strongly encouraged for non-pregnant individuals, even when they're trying to be pregnant, if they meet criteria for that, the ACIP prioritization groups. If you're trying to become pregnant or contemplating it and you meet the criteria, you should get it. That's sort of what they say. It's not necessary to delay pregnancy afterwards. You do not have to talk to an OB doctor first. You do not have to take a pregnancy test first. Given the mechanism of action and safety profile, they're not thought to cause increased risk of fertility or to your pregnancy if you didn't know you were pregnant when you got it.
Should someone get the vaccine if they're nursing? Will it help to protect their baby?
Yes to the first one for sure. They're even ACOG and the Society for Maternal Fetal Medicine are even more favorably about recommending it to breastfeeding women. In the same way they are for non-lactating women, for women who are trying to get pregnant. The theoretical concerns regarding the safety definitely don't outweigh the potential benefits of receiving the vaccine, protecting yourself and your family. There's no need to avoid initiation or discontinue breastfeeding, no pumping and dumping required if you get the COVID-19 vaccine. And as far as, how does it affect my baby? Again, there are no specific studies that prove that we're protecting, providing that immunity for breastfed babies yet. Again, those studies are being implemented now, and there's some that you can enroll in even in this state. However, the general belief is that the same immune response to other vaccines that pregnant and lactating women get when they produce those antibodies against the virus will be produced with this vaccine, and those antibodies in other vaccines certainly we know cross into breast milk and give that protective benefit to infants. On a personal note, I'm currently breastfeeding my 7-month-old, and I decided to get it myself too. So everything that's out there, certainly convinced me.
Are there any other myths or concerns that you've heard from your patients or others in the community regarding COVID-19 vaccine and pregnancy or fertility that you'd like to address?
That darn spike protein that Dr. Veer was talking about is a huge one. Most of the myths have been surrounded that, the others are just general things. So, are there preservatives or adjuvants in the vaccine? I don't know why that's a big one, right? Aluminum, thimerosal, people just need to know those things. And there's a reason we have to freeze this vaccine, right? Just as been said by my other colleagues. So there aren't any preservatives or anything like that. That's a big myth out there. But the most pervasive and prevalent one is that it's going to cause infertility. There was an article that even, looked pretty reputable by Health and News in December that equated getting the vaccine to female sterilization, right? That's a very inflammatory title for an article. Lots of mom blogs, just, devoted to discussion of this, but it's not true. The amino acid sequence in the protein that helps the placenta connect to the uterus, called syncytin 1, is not the same as the one produced as the spike protein produced by the COVID-19. So it is not interfered with by the body's immune response. There's been no increased rate of miscarriage. No future fertility effects, even theoretically, that can be thought of at this point. So, yeah, I agree with Dr. Beer, and that's definitely the big one.
Awesome. Thank you so much, Dr. Lashinsky. Just as there are questions about pregnancy and the vaccine, we also know that folks have questions about children and the vaccine. So joining us now to talk about that is Dr. Donald Bino. He's a pediatrician at Aurora Bay Care Medical Center and also the Associate Chief Medical Officer of Aurora Bay Care. Dr. Bino, welcome. Children are not currently eligible for the vaccine. Can you talk about why?
So studies will be undertaken in children currently, and those studies always start after it's proven safe and effective for adults. Adults can consent to a test to be done, whereas children really can't. They have to depend upon their parent to consent for them. So until something is proven safe in adults, they aren't going to begin the studies for children. So Pfizer started it back in November, and even as soon as October for the later teens. Now both companies, Moderna and Pfizer, are doing studies down to age of 12. After those are completed, then they'll go lower as well.
When do we anticipate children being able to get the vaccines, or how long do those studies you were just talking about take?
So it depends on the number of people in the study. They need to look at both the dosage of that the children would receive, as well as the timing for kids, because kids are not just little adults. So children and adults react very, very differently. For some vaccines, children need a higher dose. For some vaccines, they need a lower dose. They get more often or sometimes less often. So that is going to be something that science will need to tell us.
Do parents need to do anything differently for their children, especially since they can still develop COVID-19?
So we shouldn't give up on the things that have worked so far. Masking, social distancing, hand washing are all the most important things to keep in mind. Getting themselves vaccinated is also an option, and a positive one. As we know they're safe and effective, they will help to decrease the risk of bringing an illness home to their family as well.
Do adults being able to get the vaccine change anything about the way schools are handling COVID?
So it hopefully will be able to protect the teachers. But remember, it wasn't just the teachers' protection that the schools made their decisions upon. It was the children giving it to others in their own family, their grandparents, their parents. They see other people as well. So children can definitely transmit illness between one another. We have not seen them as a driver in increasing cases for the community currently, but that's what we're trying to make sure that we don't see.
Anything else, Dr. Bino, that you'd like to add about children and the vaccine or COVID?
I strongly agree that breastfeeding moms should consider the vaccine. Giving their infants protection is definitely a good thing. The other is protect themselves so that they can protect their children.
Thank you so much, Dr. Bino. Before we go to Q&A, I just want to ask all of our physicians 2 final questions. So any of you can feel free to answer this or make comments. My first question is, what are you telling your patients about the vaccine?
So I'll start. The first thing I say is that I've gotten my 2 doses and suffered no ill effects. I talk about the fact that, again, it's not licensed for children yet, but that the license for those that have the option to get it, it is a very good and safe vaccine.
For me, I would just say that, I also share that I've gotten it and not had any side effects. But then I also talk about, because my patients are typically more elderly, or they may be immune compromised and perhaps have HIV infection. So we talk also about their risk of getting coronavirus and their risk of potential complications and why the vaccine would be beneficial for them.
Well, the way I frame the vaccine conversation really is, and actually any treatment recommendation is based on science, based on safety, and also a personal metric that I use. So I personally trust the vaccine to use it, to have received it myself. My wife, who happens to be a physician, received the vaccine as well. And if I had the ability to vaccinate my family members, I would. And that's the recommendation I provide to my patients, that yes, I would definitely recommend them to be vaccinated. It's safe and it's very effective.
What I've been telling patients, about the vaccine is, first and foremost, I understand and empathize with the desire to protect future fertility, to protect our babies, to protect our pregnant moms. I would not endorse or recommend this vaccine without the backing of ACOG and the Society for Maternal Fetal Medicine, the CDC. They all express support for and even recommend the vaccine for pregnant and breastfeeding women. For most women, I think that the key point is that most people in general, but most women, there's more unknown and more risk associated with long-lasting effects from getting COVID infection than there is with the unknown of getting the vaccine. Right? I worry about my pregnant women getting the infection much more than getting the vaccine. So that's usually what I say.
Thank you. And lastly, we know COVID fatigue is real. Everyone wants to know when we can get back to life before COVID or get back to normal. What are your thoughts about that? When might that happen?
This is the new normal. I think for the safety of women, babies, our community, I think we should continue doing what we're doing, continue hand washing, continue distancing. I think acting like this is our new normal is probably the best mental game to move forward with, especially for my patients who are missing out on the logistics of deliveries and families being involved in many medical things. But you know what? When enough people get vaccinated, when enough people are immune, we can transition back to a room full of spectators for your birth and normal life for us. So I think this is our new normal, but there's an end in sight now, especially if people get vaccinated.
Yeah, I would agree 100% with that. I think it's really hard to have a crystal ball. I know, Dr. Fauci is always trying to answer that question, and it's a very difficult one to answer. And it takes, there are lots of different factors that will impact that. How fast will people be able to get the vaccine? Will a new strain emerge where the vaccine is maybe a little bit less effective? So, if we could get 95% of the population vaccinated tomorrow, then we would return to normal a lot sooner. But if we're, by the end of the year, still at only 50 or 60% of the population, we're going to wind up still needing to, be wearing masks and doing all the social distancing that we're doing right now, unfortunately. So, part of the onus is on the government and the production and the companies and the distribution and all that. But then part of the onus is also on each and every one of us to get vaccinated when it's our turn as quickly as we can, because the sooner we all get vaccinated, the sooner the rates of infection and of the disease go down, and the sooner we can start doing things that are more normal. I don't know if we'll ever get back to completely normal. Look at influenza rates this fall and winter. We're seeing none of it because we're all wearing masks and doing social distancing. So will people in the future now decide we're going to wear a mask in the fall and winter so that we don't get influenza? I think some people might. It might be their new normal. Things may be a little bit different going forward, but I certainly hope that people get vaccinated as quickly as we can get it done, and we're able to return to at least more of what we're used to.
Yeah, I agree with what's been shared. One perspective that I would look at is, we are in a state of public health emergency here at the United Nations, and we've been in that state for over 310 days and counting. So how we get through this is really one day at a time, and doing all those things that we have become used to doing in keeping ourselves safe. I do see some good news with this vaccine, and as we get more and more of our communities vaccinated, I'm hopeful really that our summer is going to be better in 2021 than it was in 2020, and similarly in the winter and fall. But what that normal is going to look like is going to be different than what it was prior to the pandemic. And we learned a lot, and as was mentioned with the vaccination, with the influenza rates, I mean, they're down to 95, 98% less than what we see. It's almost non-existent. So some of those practices, I think, will continue. If you look at some of those countries that have done better than us in this pandemic, they've had some experience with SARS in the past. So I'm hoping masking when people have a cold or are sick would become a new normal, and that'll actually help prevent the spread of some of those illnesses that we take for granted in the fall and winter.
Dr. Bino, any final thoughts?
So herd immunity is the most important part, and the best way to get it is by vaccinating. And so I agree. When the time comes that we have vaccine available for everyone, I strongly encourage people to make their decision wisely with good data, not with poor data and conjecture. So speak to your providers when that time comes, and trust that the science is there. It was not directed by the government or different agencies. It was really directed by research and science.
Well, thank you all for generously sharing your time with us today. I know you're all very busy and have a lot on your plate, so we greatly appreciate it. Now we can take questions from the media. If you could please identify yourself, the media outlet you are reporting from, and who your question is directed to. We'd be happy to answer any questions that you have today.
Hi, my name is Joshua. I work for the TV station WBAY, and I guess my question is directed to Dr. Landrum, and I know you touched on it when you mentioned towards the end of your first, you were first speaking about how like healthcare systems acknowledge that things haven't been fast enough. But I interviewed a gentleman today whose mom is at a nursing home, a long-term care facility. She isn't being vaccinated until January 25th. He's from Green Bay, and she's at a long-term care facility in Hobart. And one of the things he expressed is that sort of frustration that things are not being done quick enough. He was told one thing, that his mom would be vaccinated by December, and now she won't be vaccinated to the end of January. What do you tell people like that, or what sort of message you want to send to people like him who just are expressing that sort of frustration?
Well, I think I would tell them I sympathize and I share in their frustrations. I mean, we know that this disease can have a lot of terrible complications, including death, and so we want to protect those who are most vulnerable to that. Like this example that when you're talking about, we want to protect them as quickly as we can and get them the vaccine. It's unfortunate. I mean, the rollout and the logistics of this, to try to do this and get to nursing homes, I mean, there was no system or infrastructure to do that. So, getting the vaccine is step number one, but then delivering it is almost as much of a challenge, to try to get it to people and into their arms, just because of all the logistic challenges. I mean, you think about one, trying to produce a vaccine on this level, these mass amounts, but then you add in all the cold storage requirements and everything else, and then the lack of infrastructure. I mean, who do you ask to go to nursing homes and actually give the vaccine to? The healthcare system is currently strapped taking care of COVID-19, so we don't have a lot of spare resources to send immunization teams out to, health nursing homes, or same for CVS and these other pharmacies which are contracted to do it. They had to hire a bunch of people. So I wish in hindsight that you could go back and the processes for all that maybe could have been started earlier, so that when the vaccine was really available in December, things were ready to go. But unfortunately, that was not the case. And so I think all we can do now is, we've learned from those mistakes. I can tell you that here at Bellin, we are, ramping up. We're adding additional sites for vaccine administration weekly now, and looking at, mass vaccination sites for the general public as we move forward as well. And I know other health systems are looking at the same kind of thing. So, I can't, to that family that you mentioned, I can't say anything other than I sympathize with them, and it is frustrating, and we're doing everything we can, at least, in this sphere of influence that I have, to try to make that better.
Rob Sussman, WTAQ. Got a question for whoever actually has the answer, if anybody has the answer. Do we know how many people here in Brown County have been vaccinated?
Rob, DHS should be able to answer that question for you, because I know they're tracking all that information, along with how many doses of vaccine were distributed and to where.
And my second question is in regards to supply and demand. Has there been enough vaccine to supply every single healthcare worker and everybody in phase 1A who's wanted the vaccine, or have you had any issues with scheduling people around the number of vaccines that actually exists? And I suppose that question maybe would be best for Dr. Landrum.
That's a great question. I can say, really, I can only comment on Bellin for that, but here we have been able to get adequate supply that everyone who has wanted to get immunized has been able to get it. We're still administering first doses of vaccine to some of our employees. We had, of course, a large ramp up over the last couple of weeks, and the numbers are the rates are kind of slowing down for our own employees. But we're still, immunizing people for the first time. So we haven't had to turn away any of our staff.
Thank you.
Mm-hmm.
Hey, my name is Benita from the Press Gazette, and I had a question about, so I was wondering if anyone can talk about how, because police and firefighters are now just announced that they could get vaccinated, and as we move into phase 1B, could you kind of talk about how those people will be vaccinated? Like, will there be clinics or I guess like mass vaccine events kind of moving forward?
We are currently working with DHS, Benita, to work out all of the logistics and details. I believe they are eligible starting on the 18th, which is Monday. So we have the next 5 days or so to get that worked out and figure out so we are working on that, and as soon as more details come, we'll let you know how distribution is going to look specifically here in Brown County.
Okay, and then my second question is also for you, Claire. So I was just wondering if we're seeing like a post-holiday surge, because I know that we did see, I think, like a couple hundred cases related to Christmas. So kind of moving into New Year's as well, if you guys are expecting that.
Yeah, so as of last Friday, which was the 15th, our contact tracers, you'll have to ask to appear in our metadation separately, but our contact tracers had tied 195 cases back to Christmas gatherings. So that individual reported that they either attended a Christmas gathering on Christmas or in the days before or after. And we are also starting to see numbers come in from New Year's Eve gatherings as well. So I can email you updated numbers. I have to ask my nursing team and contact tracing team for updated numbers as of today. But I mean, 195 is quite a significant number. So we're definitely seeing the effects from the holidays.
Thank you.
I wanted to ask one more question. This is Joshua again with WBAY. So we just posted a story about that public comment has opened from the DHS, State Disaster Medical Advisory Committee's Vaccine Distribution Subcommittee. And in there, they're opening up to public comment. And they have people over the age of 70, those congregate living facility staff, which y'all just mentioned, non-EMS first responders. And they also say that they're also going to recommend for those who are, like if there's more vaccines for people who are over 65, Blacks, Latinx, and Native Americans, and those who are vulnerable socioeconomic. Is there anyone else, and those who also have like medical conditions like asthma and kidney failure, do you think there's anyone else or any other group that should be added to phase 1B that they did not mention?
I guess I don't know that I would second guess their prioritization myself. In their document that you mentioned, they do provide their reasoning for why they prioritize these particular groups, depending upon their burden of disease, their vulnerability, their risks of complications, their transmission risk and impact on the community. So all those factors considered, and I can see why they included the groups that they did. And how they prioritized it that way. But I would encourage people, as you mentioned, if they've got comments, to provide feedback to the committee.
Well, I'd like to weigh in also briefly on that. Our words are important, what words we use, and I guess we've taken a position that we don't really consider any individual group to be higher priority or any more essential than anybody else. Right now, with having a mismatch between supply and demand, we're going to have to really be strategic in how we phase in the vaccination throughout our communities. And I guess that's the challenge we're facing. If we had all the capacity to have vaccine for every individual in the community, which I'm sure we'll get to at some point in time, that is not, unfortunately, the situation today. So how do we strategically make that happen with the most impact in the short term, knowing fully well that come spring, we'll be in a better position and able to offer the vaccine to pretty much anyone and everybody that is willing to receive it. So these are really some of those steps. When you look at the scale of this pandemic, we're talking about a pandemic not in Brown County or Wisconsin or the United States. We're looking at hundreds and hundreds of millions of people impacted. So this is really not something that we as humans have accomplished ever. So yes, we're going to work our way through these challenges and get to a point where we'll have supply available for everyone that needs a vaccine.
Hi, this is John with NVC 26. This has been talked about a little bit already, but if phase 1B includes opening eligibility up to anyone 70 plus, can you share what that plan would look like in Brown County? Are we going to see some drive-through vaccination offerings, or how will people go about signing up?
Again, we're working closely with DHS as details come available. We're not at that stage yet to know what it will look like, but County Public Health is working with all of our healthcare partners to determine what that would look like, and it probably will be similar to the flu clinic that we did with Bellin at Lambeau Field. It would look something like that. It might not be exactly the same thing, but a mass vaccine clinic could look like a drive-through that we had situated at Lambeau Field.
Thanks, Claire. And I believe the health department has been a resource to school districts as they've been navigating this pandemic and weighing the risks and benefits of how to go about offering their education. Now that most area schools have returned to offering some sort of in-person teaching, but the largest district, Green Bay, has remained fully virtual since last March. Can you kind of provide some perspective on what goes into the advice provided and conversations with districts about when it makes sense to stick with virtual or offer in person?
Yeah, so we've been working with school districts since the beginning of the pandemic. We've been providing data, we've been providing guidance, we've been providing information and recommendations. All of the data that is provided is available to the general public as well. So that's the data you'll see on stayhealthybc.com, as well as DHS has extensive amount of data available to the general public. But I think it's important to remember that each school district and school board is responsible for making their own decisions about how to move forward appropriately for the populations that they serve. So we've been giving guidance, we've been providing data all along, but the Green Bay School District and their board is responsible for deciding how they would like to act, and thus far virtual has been the best choice for the population that they serve. So that would go for any school district in Brown County, as well as local businesses and establishments here too. We provide guidance and data and recommendations. They are the final decision makers. Any other questions for myself or any of the doctors that we have on here today? So thank you again for joining us today, and thank you to our panel of doctors. There's not a media briefing next week. Going forward, we will have briefings as the situation warrants. So we'll send out a media alert for prior to any future briefings, so you'll be aware. Happy New Year to everyone and have a great day.